Hello, everyone. I am Gabrielle Mason, writer and reporter with Becker's Hospital Review. Thank you for tuning in to the Becker's Dental and DSO Review podcast series. Today, I am pleased to be joined by Thorne to discuss new challenges that have arisen due to COVID-19, what's next, and much more. Thorne is CEO and founder of Pacific Dental Services, a leading dental support organization established in 1994 and headquartered in Irvine, California. Mr. Thorne's leadership and influence extend beyond Pacific Dental Services to the wider dental industry. He was instrumental in forming the Association of Dental Support Organizations, which represents some of the largest DSOs in the world, and he served as the founding president for the first 3 years. Thank you so much for talking with us today.
Oh, well, thank you for having me.
Of course. With that, let's jump into the first topic of our conversation. Our first question is, considering new challenges that have arisen due to COVID-19, what are some strategies dental practices can use to engage patients?
Right. It's a great question. And we have an early glimpse of how patients are responding to this. As most everybody knows, dentistry was pretty much shut down for approximately 2 months. Could only do emergency services. But the initial signs are very positive. It's I think, a bit surprising to most of us that it's as strong as it is. Our call demand is up, and the patient wanting to come in. Now, the one area that's a little interesting is hygiene. The demand there isn't quite as strong. I think people are a little nervous because there's been so much discussion about blood and splatter out there. And I think what dentists can do and dental offices can do is to be over-communicative with their patients about how safe they are and the things they are doing in their practice to maintain safety, not only for the patients, but also for team members. You know, the way I think about it, too, is dentists have always been really safe. And dentists were at the forefront of some of the issues with the HIV crisis back in the late 80s and early 90s. And they're taught at an early stage in their careers in dental school how to deal with splatter and aerosols and blood. And so dentists historically have been very, very good at it. And I think to reaffirm that to their patients, that they're not only safe, but they're safer now than ever before, would be a great way to engage patients. And also one last thing is, dentistry, I think dentistry, my personal opinion, is an essential service. Mm-hmm. It should have been put on the sidelines during the crisis. Now, if we look at the comorbidities of the COVID-19, if somebody gets the coronavirus and gets COVID-19, the comorbidities with hypertension, with cardiovascular disease, with diabetes, dentists can help in all those areas. And so patients should not be reluctant to maintain good oral care. We have a saying in our organization that good health begins with good oral health.
Right. I think the rapid rebound that the dental industry is seeing really speaks to all of those points. I know another question a lot of people are curious about is the role that teledentistry will play. Right. I know the role has changed amid the pandemic, but what role do you suspect teledentistry will take after?
Teledentistry is very interesting because, as we all know, most of dentistry can't be done through a video. Right. They actually need to see a dentist, and a handpiece needs to run most of the time. So it's interesting, but it absolutely is a key dental engagement strategy. We quickly, I have our data. We at Pacific Dental, we quickly pivoted, and we had always planned on getting teledentistry going, but frankly, it wasn't necessarily worth the investment at that point in time because there was no reimbursement and things like that. We didn't know what we didn't know, but obviously the COVID crisis brought that on. We implemented teledentistry, and now it's a key patient engagement strategy. Roughly 60% of the patients that book a teledentistry appointment end up having to come into the office for care, a little over 60%. Okay. But about 40% on the other side don't need to come in for care at that point in time, and they just wanted to talk to a dentist. So I think it's a great thing. I think all dentists should have it available and make it part of their practice.
Yeah, just a little sidebar. What those 40% of patients, are they just looking for, do they just have general questions? Or what?
Yeah, just general questions, or maybe they have some minor something that they wanted the dentist to comfort them with, or they didn't need to come in immediately. Maybe they had a question around straightening their teeth, maybe something around orthodontics or something like that. So, the range of questions from people is really big and wide.
Okay, thank you for that clarification. And how do you think dental practices will more closely resemble physicians after this, if at all, and how will they differ?
I'm not so sure they're going to resemble physician practices so much from an operational standpoint. We do know that dentists will most likely be seeing less patients in the future because of the PPE requirements. So on average, our supported docs right now are seeing about 25% less patients per day. And that's going to have a material impact on the whole industry of how that shakes out over time. Most dentists are used to moving operatory to operatory and seeing multiple patients at a time. And most of that will probably come to an end through this crisis. So we'll see how that works. Whereas physicians, they may still be able to do that. I don't know. We support 3 physician practices. They're just coming back online now, so we'll see how that works. But as far as I think one big thing that's going to happen is people are looking at what we call at PDS the mouth-body connection, more commonly known as the oral systemic link. Basically, what's going on in our mouth affects the rest of our body. We know from the studies the effect that the bad bacteria in our mouth can have on Alzheimer's, on cardiovascular disease, on diabetes, on hypertension, and things like that. And so in that respect, I think dentists are definitely moving towards the physician area with more testing to test levels of bacteria, to know the blood work of a particular patient so they know how aggressive they should be with treating periodontal disease or periodontal abscesses or root canals and things like that. So I definitely see dentistry moving more towards medicine, not necessarily physician practices, but definitely more towards the overall healthcare system.
Yeah, definitely. That makes sense. And I think we're all seeing that now too. Right. And kind of in relation to that, what do you think offices can or should do in preparation for a potential second wave? And if a second resurgence occurs, what would that mean for dental practices across the country? Do you think we'd see this widespread shutdown again?
I think it's a great question. So it's interesting. I just had a meeting with our team, and my call out to the team was, we need to stay diligent. We need to stay focused. Even though the number of outbreaks and cases around the country is decreasing very quickly, we still don't understand all the reasons why. The science hasn't proven out why it's decreasing so much. And is it a super simple example? Is it just because it's summertime? Is the heat causing the virus to go down, or is it truly the social distancing and all the other things? Well, we don't know all that yet. So be diligent. Don't let up. Every patient gets tested before with a thermometer. They get their temperature tested. They're asked a series of questions about for an assessment process, and be diligent. But then, if we look at the number of outbreaks in dental offices in the last 60 days, and I think nobody would know this better than Becker because you report on all this. I don't think there's been any, right? There's been no reported outbreaks of the coronavirus in dental offices.
Not that I have seen, which, yes, you're right. It would be a huge story.
During the last 75 days, millions of patients have gone to the dentist. Millions. Mm-hmm. In the last 75 days, right. I think our supported docs have seen over 750,000 patient visits. So I think that it'd be great if somebody did a study. Maybe Becker ought to do the study. Ask all the dentists around the country of the incidences of transmission within their practices, and we could document that across the nation. But I read just about everything you guys probably read, and there hasn't been that. So I think it's safe. We can't let up. If there is a second resurgence, I think dentistry, I think it showed an identity crisis. I think the COVID crisis showed an identity crisis for dentists. Dentists, and this is my personal belief, are essential. They should have been there in the offices to help. They could have done testing in the offices. They could have really helped out all of America. They could have been open for more of the emergency services. We at the Pacific Dental Supported Practices, we had over 41,000 new patients in 45 days. 41,000 new patients search us out for emergency care. Most of those patients, their dental office was closed.
Wow, so, that's incredible.
Yeah, you start looking at the data, and it's really incredible. So I think if there is a second resurgence, and there very well could be, I pray that there isn't. I think all of us pray there isn't, but we need to be better prepared. And I think groups like the ADSO right now are working on these issues to be prepared and get out in front of this. And I think they're doing a great job leading this effort. As you know, DSO is now probably 25 to 30% of all the practices in America are supported by a DSO. And so they're taking a great leadership role in that area.
Yeah, I really think dentists and dental practices in this time have really just shown how they are masters of sterilization and infection control, and really how much they can be leaned on during this crisis.
Exactly. I couldn't have said any better.
Well, thank you so much for your time and your thought-provoking responses today. We also want to thank our podcast sponsor, Pack Dental. You can tune into more podcasts from Becker's Healthcare by visiting our podcast page at beckershospitalreview.com.
Thank you very much. Great questions. And again, we thank you guys for your support of the industry, and your communications out there really helps all of us do a better job trying to lead. So thank you.